Welcome back. Now, the African Snakebite Institute has warned that there's a critical shortage of antivenom countrywide. In a recent incident that triggered the alarm, a Cape Cobra attacked a dog in Noordhoek, this in Cape Town. The pet owner rushed the dog to the vet, but learned upon arrival that there was no antivenom in stock. John Marais, African Snakebite Institute CEO and snake handler, joins us now for more on this. And Johan, thank you so much for your time. Good afternoon to you. I am not happy with what we're about to talk about, because if you know me, you know that my fear for snakes, it's on a different level of fear. And now there's no antivenom. What does this mean for both humans and animals?
Yes, it's a problem. You know, our antivenom is made by the National Health Laboratories. And for the last 6 to 8 months, we've really been struggling to get stock. So there's this massive shortage. And at the moment, the veterinarians need stock of antivenom. They can't purchase it. So dogs are getting bitten by snakes and dogs are dying.
So does this mean the same for human beings? That human beings, should they be bitten by, I suppose, quite a venomous and dangerous snake, that they may run the risk of also dying because of the shortage?
Yes, look, it is a problem. Our major hospitals still have stock and they're getting back into production, but there certainly is a shortage. And there are hospitals that are struggling to find stock. So there is a danger, and we see this in places like Maun up in Botswana at the moment, where we've had some snake bites, and there is no antivenom. So yes, it's a crisis. It's a bit of a disaster.
Okay, so Johan, what do we do in the meantime? What happens while we're waiting for hopefully this stock up to take place very quickly?
Look, the procedure still is, if we have any snake bite emergency, if a person is bitten by a snake, they need to get to the nearest hospital. We need to stabilize the victim, and they need to get the necessary treatment. And all snakebite victims don't need antivenom, but it's still important to get to the hospital. The same with your pet. If your pet gets bitten by a snake, you need to get the pet to a veterinarian so they can assess how serious it is and give supportive treatment in the meantime. So, you know, once we've stabilized a patient in a hospital, if the hospital doesn't have antivenom, they can then make arrangements to obtain antivenom from another hospital, or maybe transfer the patient.
Right.
But it's vitally important to get to a hospital, because they can do the necessary to stabilize you. If you're battling to breathe, they can assist breathe you. So any snake bite, get to a hospital.
How important is also education around snake bites? You mentioned some are not so venomous, but some are quite dangerous. But how important is education for, you know, South Africans, for anyone really, in terms of how to handle snakes?
Yeah, I think it's important. I think it's important to get to know the snakes of your area. We go to great extremes to educate people. We provide free posters of dangerous snakes of all the different areas, the different towns, the different cities. And if you know what snakes you have, you know what you're dealing with. I think even more important is how you should behave. And we always say to people, if you have an encounter with a snake, any snake, you need to back off at least 5 paces immediately. Don't try and catch them if you're not trained in how to do that. Don't try and kill them, because that's just looking for trouble. Get away from them. If you're 5 paces away from any snake, you cannot get bitten.
Yeah. Should farmers also be worried at this time if their livestock also get bitten by snake? I mean, what should farmers do, and how should they prepare themselves in terms of how to handle, you know, a snake bite?
Yes, again, it really is a crisis, because the only correct treatment for serious snake bite, let's say you have a puffadder bite or a black mamba bite or a cobra bite, the only correct treatment for severe envenomation is antivenom.
Right.
So if a farmer has one of his farm animals bitten by a deadly snake, he needs to get hold of a veterinarian. And in the very serious bites, they're going to need antivenom. There's nothing else that's going to help.
Johan, before I let you go, do we know what led to this shortage? I understand the backlog, it's about 6 months worth of backlog. Do we know what led to this shortage?
I think it's a question that one should really ask the National Health Laboratories. But we do know that they've been having major problems with the power outages, number one. And then also some of the ingredients that they need for the production of antivenom, some of the equipment. There's been some problems with the supply chain. I'm sure that a lot of this stuff comes from overseas. and that's also been problematic. But my guess would be that the power outages have been a major contributing factor.
All right, we leave it then. I appreciate you speaking to us about this. John Marais, snake handler and CEO of African Snakebite Institute. Thank you so much for your time. So not some good news if you're not a fan of snakes or you're absolutely terrified of snakes like myself. But whatever the case is, make sure that you get yourself to a hospital should you find yourself in the unfortunate event of a snake bite. If your animal, your pet, has also been bitten by a poisonous snake, also get your pets to the nearest vet so they can handle that matter with the urgency it deserves.